Thank you very much, Jim, and thank you all for attending this session this afternoon, which I think takes us to the heart of many of the issues that we have to address: politics. Can I start with a very simple statement about public health and politics? Just a few definitions to throw out there that I'm sure we all know and understand, but it's worth reminding us about them. Public health, of course, addresses health at a population level. Whether that population is very small, it might be a local area, whether it's a region, a town, or it might even be a city or a nation. It's necessarily interdisciplinary. It looks at the social, economic and environmental determinants of health, and its work is achieved, as the CDC in the USA puts it, by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing and responding to infectious diseases. So it's dealing with a whole community, whether it's a locality or whether it's a nation, or whether it's a region within our globe. As Michelle said this morning, there are parts of the world that can be compared and contrasted in terms of the results that come from their policies or lack of policies. Politics takes us into a completely different space. Politics is about influence. It's about power. Within those localities, regions, nations, or the global community itself, it's about who the winner is and who the loser is. When it comes to the laws, the regulations, the distribution of resources within not just government, but also the community more generally considered. So public health takes us to the population level, whether that's a locality through to a nation or a global region. Politics is about who has power and influence in those localities, in those communities. So even when you put the definition out there, you can see that politics and public health are intermixed in a very important way. Now, there's a scientist in all of us, and it's one of the better aspects of humanity that there's a scientist in us. It takes us to think about what works and what doesn't work. It takes us to do research and to find out what is actually the case, as opposed to what people might think the case to be. It evaluates performance, as well as just carry it out and then forget about the consequences that might flow, and they might be different from the intentions. In other words, what needs to be done is done if we use science. Politics being of a form that we might call applied science. That's one way of looking at politics. Applied science. Find out what works, what doesn't work, what the laws of the world are, and then apply those to government. It's pure and it's simple. And it's one way of looking at the art of politics, the application of science to policy. But of course, there's a realist in all of us as well. There's a realist in all of us as well that tells us that politics, when it comes to decision making, isn't always rational. Who sets the agenda? Who sits at the table of power? Who can best influence the decision makers within the government and the community? What factors come into play when decisions are being made? In this scenario, public health is there, and all of the evidence that we associate with it, it's there, but it's with other things, and those other things are ideas. The ideas may in fact be prejudices. Interests, vested interests are there. Public opinion is there, along with evidence. And so when you go from the scientific world into the political world, we would hope that evidence goes with you, but inevitably it's part of a bigger mix and a more complicated mix. So what I want to look at today, in the time I have available, is to look at when you have the evidence and you're taking it into the political equation, what are the factors that might mean that that evidence won't be taken seriously or will indeed be rejected? What are the factors that influence the effectiveness of the evidence that we have. What do the people who believe in evidence come up against? And I've identified a number of factors that I just briefly want to talk about. The first is fundamentalism. Religious fundamentalism, ideological fundamentalism. It leads to watertight beliefs which evidence-based arguments can't penetrate. For the fundamentalist, it is values, not values and evidence, that should determine law and regulation. A classic case study, of course, is the international war on drugs. Ideologically very pure, but seriously challenged in the real world in terms of the objectives that we would reasonably expect of it. So there's the first challenge for science. How do we respond to that? Well, the first thing I think we need to do is stand up for science and its methodologies with a humanistic element. What does any policy mean for actually existing and sometimes flawed human beings? I've just been to a session where one of the attendants and the speakers talked about what's happened in Crimea since the Russians came back in terms of opioid substitution therapy and what that actually means for the individuals living there. So I think it's a point of getting our heart and soul into it and put across to the fundamentalists, of course, that yes, you have your views, but the world is more complicated, and as a result of sticking rigidly to your view, these consequences come that are not in anyone's interests. Which brings me to the second problem that we can get, and they're not necessarily in order here. The second one is vested interests. It goes without saying that virtually every initiative designed to improve public health will affect actually existing interests, whether they're personal, commercial, or political. The public interests will more often than not challenge these private interests, and campaigns to oppose evidence-based change will inevitably result. Some transparent and some behind the scenes. Such campaigns frighten politicians and they can be very sophisticated and effective. So, for believers in evidence, think politically. Look for alliances that you can use in the political battle, that you can have there with you when the vested interests come in and play their particular game of defending policies and institutions that may not be producing good results for the people. Then there's risk. Politicians vary in type and style. Some are very risk averse. Some are very cautious. On the other hand, some are quite entrepreneurial and quite happy to take a big risk. The risk-averse politicians will worry not only about the politics of dealing with fundamentalists and vested interests, but a range of other factors will come into their thinking. A policy may be a good one in theory, but what about its feasibility in the context in which it's to be established? Are the capabilities and resources there to make it work? Is there adequate political support to survive a campaign of opposition? So when believers in evidence go to the political arm and advocate, they should not ignore these questions of implementation and questions of opinion. Politicians will want to know how to manage those risks, what resources will be needed for success, and how opinion is to be influenced. If you have thought through the implications of the issues, it's much easier to convince governments on what should be done. Remember, a good public policy is not just relevant and evidence-based, but it's also feasible and acceptable. Then we go to the issue of trust. The credibility of researchers is always on the line, not just one to the other and through peer review, but also to the general public and their political representatives. Advocates should never oversell their findings or cut corners in order to exaggerate an argument. This can undermine the risk of the scientist so easily, because science is so important, evidence is so important, that we should never sacrifice it in small ways that would appear to perhaps gain us an edge in the short term, but over a period of time may undermine belief in science as such. Politicians do a lot of spinning, as we know, spin, where you exaggerate or you put a flavour around something that's not really in accord with its reality. And evidence, people may be inclined to join that school of thought, but they put at peril their greatest asset, which is their scientifically grounded recommendations. So maintaining the highest of standards in research and advocacy is very important. But let me now say something else about trust. Trust is not just an attitude that emerges, but is also a factor that can be developed. And Jim has already indicated in his preliminary comments one way to do that. Institutions of higher education and research should be vigorously independent, but not disengaged. What matters to the community needs to have analysis, needs to have solutions. And those of us who engage in research are in a good position to offer good advice on all of those issues. Go into the community, find out what's going on, what are the problems that are emerging, and seek to bring about solutions. Now, sometimes, as Michelle said this morning, there are activists throughout our own region here that in some parts take risks in doing those important things via engagement with the community who needs assistance. But it's so important. That trust does build up. And when people are confident that what the researchers are saying produces good results, it's very interesting to see that there's not usually a turning back. Let me talk about my own country of Australia. Australia has gone a fair way down the path of harm reduction. Not the whole way, but has gone a fairly significant way. But every time there's now an attempt to push back, there's resistance because it's been institutionalised, it's part of the system. People have seen the good results, and efforts to try and go back don't work. So by engaging with the community, taking up their issues, offering good results, you do build up a support base that's very important. Another issue that can come up in terms of evidence is the question of priorities, and it was raised by someone this morning in a question. Public health competes with resources in all sorts of ways. Within the budget, within the health budget, you can spend money on hospitals, you can spend money on community-based education, all sorts of ways you can spend money. And priorities will always be there. Governments will have priorities that may or not be your priorities. Particular circumstances will matter, and crises can quickly create demands for a change in policy. Even a government regarded as on side with public health won't necessarily be able to do everything that you may want. So one step at a time, I think, is usually the way in which we can achieve some of these important results. Be up to date on what's happening in the world. Know about the constellation of forces that are there. Be patient when necessary and bold when circumstances demand it. We had a very interesting presentation in Australia recently from Portugal on their drug policy when a major crisis was developing in their society, was affecting all segments, and they had a very bold response to it. But they were ready for the response. So even though sometimes we need to be patient, sometimes we need to be bold when circumstances permit. Finally, there's the question of communication. I simply make a very tactical point here, that the world occupied by the researcher, the scientific world, is quite different from that of the politician, the political world. The time constraints under which they work are different. Using the right words, explaining in an understandable way, and getting it all across in a time-constrained environment can be very difficult. But should never be taken for granted. Think about the person or the persons that you're addressing when making a case. Don't assume things about them that are unrealistic. They will almost certainly not be from a research background and perhaps not even academically credentialed. So think about it. I put it this way. There's all this wonderful research goes on, it slowly builds up, recommendations follow from the research, that will produce good results. That filters into government. The bureaucracy know about it. The bureaucracy then want to go to the politician. And you know what that means? A half-hour meeting with the minister, usually. That's where a policy... And you want that minister to take it up and take it into a cabinet and try and make a policy. And if you muck up, if I can use that Australian expression, I don't know, if you can not successfully transmit the idea, it may fall back, and what is a good idea may not become a reality. So make that last half hour really count. Really work on it, how you're going to present. So I think there's some of the issues that I think come up when you're having to deal with the political side of things and you have good evidence. But my last point is to just quickly say that we're now living in a different world. It's amazing to think that what we thought was a scientific underpinning to everything that we did is being questioned. It's being questioned. Reliance on beliefs and treating your opinion as a fact, rather than saying, well, that's my opinion, let's examine it, explore what it means in practice. A distrust of science and all of the inconvenient truths that science is throwing up. A prioritisation of feelings over reasoned argument. Complacency about or hostility to politics and the open society. This is a real challenge. I mean, I mentioned 8 factors that come up when you're trying to influence government. This is the big issue of the contemporary world, where the questioning of the very methodology that is behind what we're doing in conferences like this is being questioned at the highest levels of government. And recently in the United States, the Centers for Disease Control in Atlanta were having a meeting, and they were told that when they make submissions for the budget, there were certain words they shouldn't use. Diversity, entitlement, vulnerable, fetus, transgender, science-based, evidence-based. This is an assault on the very foundations of the open society and the results that it can produce to improve the welfare of people. So we need to defend science. And it's, as the Albert Einstein Memorial at the National Academy says, the right to search for truth implies also a duty. One must not conceal any part of what one has recognised to be true. And I think more than ever, we need to really focus on those issues and make sure that the wider world understands the implications of the rejection of those views and what it means for real human beings living in our society. But finally, let me just say something about how we should proceed as researchers and advocates. I won't go into any detail there. Tom Nichols has written a book on expertise. He makes the point that we should strive to do it better than we're doing it now. And finally, if I can finish with the point I made at the last City Health International Conference in Basel, I think we should be looking at new ways to consider complex problems by involving the community in a different way through citizens' juries, people's assemblies, where reason plus evidence plus deliberation in those mini publics can look at public policy generally. So, ladies and gentlemen, just to conclude, I think we need to think politically when it comes to taking evidence into the sphere of government. Think about all of those problems, because what you find is so important. It's so important. We must make sure that it's effective in the political world. But finally, I think this post-truth phenomenon represents the major challenge to all of the work that we've been doing over many years, and that's a culture war that can't be avoided. Thank you very much.